is the thyroid gland. It has an isthmus and two lobes. Each lobe is covered by the sternothyroid, sternohyoid muscles, and both are overlapped by the sternomastoid muscle. This is the isthmus. It lies over the second, third, and fourth tracheal rings. This is the levator glandulae thyroidae, stretching from the upper border of the isthmus up to the body of the hyoid bone. It's the fibrous remnant of the thyroglossal duct in the fetus. This is the cricoid cartilage lying below the thyroid cartilage. This is the cricothyroid ligament extending between the cricoid cartilage and the thyroid cartilage. This is the cricothyroid muscle, one side. It extends from the side of the cricoid cartilage to the side of the thyroid cartilage. This is the lamina of the thyroid cartilage. The upper end of the thyroid lobe reaches up to the oblique line on the side of the thyroid cartilage, where the sternothyroid muscle is inserted and the thyrohyoid muscle arises. Here is the thyrohyoid membrane extending between the thyroid cartilage and the hyoid bone. It's pierced by the internal laryngeal nerve, which is a branch of the superior laryngeal nerve, and is accompanied by the superior laryngeal artery, which is a branch of the superior thyroid artery. They pierce the membrane at the posterior border of the thyrohyoid muscle. This is the inferior thyroid vein draining the isthmus and descends in front of the trachea to end in the left brachiocephalic vein. The lobes are drained by the superior and middle thyroid veins. This is the superior thyroid vein. It emerges at the upper pole and passes laterally to end in the internal jugular vein. This is the middle thyroid vein emerging at the lower pole. Normally it ends in the internal jugular vein. This is the superior thyroid artery. It arises from the beginning of the external carotid artery. This is the inferior thyroid artery. It is a branch of the thyrocervical trunk which arises from the first part of the subclavian artery. It ascends along the medial border of the scalenus anterior muscle and then turns medially at the level of the cricoid cartilage. Here, it crosses the termination of the first part of the vertebral artery as it disappears at the upper angle of the triangle made by the scalenus anterior and longus colli muscles. The inferior thyroid artery crosses the sympathetic trunk deep to the contents of the carotid sheath, namely the common carotid artery, internal jugular vein, and vagus nerve. Near the lower pole of the thyroid gland, it meets the recurrent laryngeal nerve, and both of them disappear deep to the gland. The artery gives off an ascending branch on the back of the lobe to anastomose with the superior thyroid. There are two important nerves related to the thyroid gland. These are the recurrent laryngeal nerve and the external laryngeal nerve. This is the recurrent laryngeal nerve. It arises from the vagus nerve. On the right side, it arises in the root of the neck and winds round the first part of the subclavian artery and ascends toward the larynx, where it disappears deep to the lower pole of the thyroid gland. Note that on the left side, it winds round the arch of the aorta and ascends in the groove between the trachea and the esophagus to reach the thyroid gland. This is the external laryngeal nerve. It is a branch of the superior laryngeal nerve. It passes to the cricothyroid muscle deep to the upper pole of the thyroid lobe. This is the superior laryngeal nerve. It arises from the vagus and passes medially deep to the internal carotid artery and divides into internal and external laryngeal branches. Note that the superior laryngeal nerve is deep to the external carotid artery and internal carotid artery, while the hypoglossal nerve is superficial to both arteries.